Hello and welcome back to the Co-Treat. It's Jonathan. What did I say? I'll be your occupational therapy practitioner today. It's been a while.
It has been a while. Wow. Hi, I'm Magnolia, your speech professional today.
Hi, and as you can tell, we're a little out of practice.
Yeah, definitely.
It's been a little bit since we've been here. Life has just been a little busy.
Yep.
We did really good
We
for
did.
like a few weeks of like recording stuff, scheduling it, doing the thing, and then, you know, life is busy.
It is.
And this is just a little passion project, so this kind of takes the back seat for a lot of things.
But here we are.
But here we are.
Trying again.
We did it. Thank you so much for listening to our OT month episodes. Super fun. I had a great time recording those.
We learned a lot.
Love. So sorry to all the speechies out there that we completely just missed speech month. Sorry, Magnolia.
Well, speech month is a very busy month. They put us
Yes.
in May. I mean, all the end of the year activities for school stuff.
Yeah.
It's just kind of
There's everything happening
teacher
all at once.
appreciations in the same month. It's a really
Yeah.
weird month to
A lot of people
choose.
start on vacation that time
Yeah.
because it's the first, start of summer.
So it was a busy time. But now that y'all have all relaxed after speech month, now we can talk about speech.
Yeah, so
So-
we're going to dedicate today to speech.
Woo!
Yay! I think we've decided to just do one episode.
Yeah, we're just going to let Jonathan explain it all
Yeah, that's
to
right.
us.
I'm going to give you the rundown, the 411 of what speech is,
Yeah.
because I'm super qualified to do that.
You think so, occasionally.
Disagree.
I'm just kidding.
Disagree.
I'm just kidding. He always asks good questions.
I love learning. And I love speech. Speech is cool. I have said before that, like, if I didn't, in the world of therapy, if I was going to do anything else, I would do speech.
That's
Like,
fair.
if OT was not where my career landed, I
Yeah.
would want to do speech.
Yeah.
Either that or maybe more like traditional, like, psychotherapy. That would
Okay.
also be interesting. I think I could do that too.
Yeah. I think I could do OT, but there's also, like, a lot that I'm like, I could never.
You'd be really good at OT.
Like, for, like, the sensory type stuff, I'm like, okay, that sounds fun. I don't know. Some of the ADLs, like, the things you have to go through really gets me. I just don't know if I can
Yeah,
handle
there's
that.
dirty bits. But it's, I mean, speechies have to do, like, oral
But it's like, you know,
give you
people
oral
are
hygiene and
different. Like,
stuff.
I can look in somebody's mouth all day, but you touch me with your feet and I'm done.
That's fair.
Like,
That's
it's
fair.
just different things.
Yeah. I don't know. It doesn't bother me. I guess I have a hard time, like, relating to people who have those struggles
But
because
yeah.
it just doesn't bother me,
That's fair.
you know? But it's
So-
fun. You'd be great at OT.
Anyway, enough about OT.
Enough
today.
about OT. Today is all about speech.
It is.
So we're going to I guess maybe kind of compile what we did in OT month with like a what is OT and a history of OT, just kind of in a very brief synopsis for speech.
Right.
I think is what we decided. Because, I mean, and that's no shade to the speechies. Like, speech has there's so much to say about it. And we will say plenty more.
And that's the thing.
in
I think
future, but-
there's so many topics in speech. It's going to be better just to, like, address some of the topics individually
Yeah.
throughout our podcast.
Yeah.
So,
I think it'll be fun.
yeah.
So, how do we want to start? We wanted to, do we want to give,
I don't know. I'm sure they want to hear from you first.
Okay.
I mean,
So, like-
so let's figure out what Jonathan knew about speech prior to becoming part of the therapy world. So, like, prior to even getting into OTA school.
Okay. I guess, well, to be totally honest, I didn't really have a whole lot of exposure to, like, speech therapy in general. I mean, I guess I just never had a reason to, like, be involved in the speech world. So, like, I didn't know any speech well, I guess I knew your mom, but, like, I didn't know that's what she did.
Right.
Like, I didn't know your mom was a speech therapist. And we never had any conversations about it. I guess my only exposure to, like, speech was at school when other students had, like, speech class.
Right.
And mostly it was kiddos, as far as I knew, it was kiddos that had, like, articulation problems. What I now know as articulation problems
Yeah.
is, like, kids who had a hard time with their R's or their S's or, you know, their TH sounds or whatever. Like, whatever it was, those... I knew that there were kids that, like, saw a speech teacher at school. And then I guess if you had, like, asked me, I probably would have just said, like, oh, a speech therapist is somebody that, like, helps people talk. And probably
Yeah.
would have, like, expected to see it, I don't know, with kids who are, like, learning. Because, I mean, that's the only exposure that I had.
Right.
So I guess that's probably what I would have said beforehand. Yeah.
Okay.
I think that's about it.
I mean, I think that is like probably the most common misconception is working on R. Like, that's really the biggest one.
Yeah.
It's like, that's all we do. Even though I think that's like every speech therapist, like, almost least favorite thing. I mean, there's some people who are really good at it and who really love it.
Yeah.
But I think we also just don't love being known as, hey, those people that work on the R sound. And that's it. So you get that common misconception a lot. But what did you learn about us in OTA school? Did you learn anything about us?
We did not talk about speech very much. But I think that's kind of true in general.
It
like,
is.
What I've heard across the board from a lot of therapy professionals is in our individual programs, we don't really talk about the other disciplines a lot. I guess probably because each of our fields is just so broad and like you only have so much time. But I really kind of find it a little bit of a shame that like we didn't learn a lot. Well, I guess what we did, okay, so we did talk about in my OTA program, we talked about like OT has a role in like feeding and eating, because that's an ADL.
Right.
But then we were also like had conversations about how like that's really also very much a speech thing, and they very much are like the bosses of like eating and swallowing.
Yeah. There's a couple areas we cross OT and speech.
Yeah. And so like that was also another in my OTA program. That was when I became aware that speech people worked with like, swallowing difficulties and feeding things, and that's really what I learned then.
Okay.
I've learned a whole lot more since.
Well, that's good.
But I want to know, how would you describe like what is speech therapy? Like it just kind of in a.
And I will. Okay, I'm going to say this first though. I feel like my definition of speech therapy has changed over the last 5 years.
Yeah.
I think it has for everybody in the speech profession.
Okay. Interesting.
Not just like, I don't know. I feel like we're all continuously trying to change our wording.
Okay.
But speech particularly, like for example, the Better Speech and Hearing Month naming of Speech Month has been, you know, we're not really want to advertise it as there is a better way for speech and hearing. So kind of trying to get away of that idea of like, hey, I'm your speech therapist, I'm going to fix you.
Yeah. Type
situation, which is, it's kind of hard to define speech therapy whenever I used to say, you know, we, you know, kind of, I don't know, I always got told of like, oh yeah, they fix articulation problems, or they, you know, fix language disorders, stuff like that. So it's a little bit less of that and explaining what all we do. So it's almost just easier to kind of talk about like who all we work with and who all we can help. But I think to define like speech therapy, the overall goal is to help people communicate within their environments, to be social, like actively social in their environments as they want to be able to be social in those environments. And that also includes being able to, you know, swallow appropriately, being able to participate in that, eating with others, things like that. That's not really the best definition ever, but I'm trying to just give off like the idea of like, there's the big idea for us is just to help people communicate their wants, needs, whatever they want to say, to be able to participate in their environment. Same with feeding and swallowing, so they can participate in those everyday activities safely, of course. So that's kind of like the overall idea. But to kind of explain, you know, who all we work with, that's kind of how it defines the little aspects of what speech therapy does, because it is so broad. It is huge. To the point of, I think one of these episodes, I forgot some of the things we did, because if you don't work with it, you kind of forget about it. So it's just such a broad thing. But I think every speech therapist's, you know, main goal is, I'm trying to help my patient communicate within their environment, or I'm trying to help my patient participate in their environment, whether it's feeding or swallowing. So I think that's the bigger picture.
Okay.
I hope that makes sense.
Yeah. I mean, that makes total sense. Like, but yes, I think it makes sense. Because like you're moving away from this idea of like we're fixing what's broken.
Right.
And very much, I mean, it sounds like a shift to a strengths-based kind of approach to care in general.
Right.
Because
which is kind of like our mode of what we're talking about in this podcast, mostly.
Right. Yeah. And I think that's a big shift. I think we're seeing that as a shift also in the world of OT.
Right.
Where we had gotten into a rut of like, we're going to fix your body. But like, really our whole job is about participation, which is very much what you're talking about too.
Right. But we're just, a helping profession is the way I like to explain it. A big helping profession for those who need extra assistance in those areas. Especially those who want also. Some people just want assistance in these areas, which is also an interesting thought to have. Not all want speech therapy, and that's also okay.
Sure.
We're just here to help out what needed.
Yeah.
And wanted.
That's interesting.
Yeah.
So then should we, since you're talking about like the different populations,
okay,
makes a difference and kind of it maybe a little easier to kind of describe.
Yeah.
So like
I think that's why I have such a hard time, because it's so spread out.
Sure.
So we can kind of talk about some of the different populations that might help.
Yeah. So who does speech work with?
Actually, I have a better idea
before
just who speech works with.
Okay.
So I did kind of split it up in some of these areas, and ASHA does as well. ASHA is our national board, American Speech Language Hearing Association, because we're paired with hearing professionals. So the areas that we have are speech disorders. So that is everything to do with speech sounds, whether it's fluency, articulation, like you're talking about, like producing the correct R sound, things like that. To after stroke patients, they might have dysarthria, things like that, motor movement issues. There's lots of names we can use in these. We have apraxia, that's with kiddos or with adults. Anything that is going to affect that speech sound, like the speech production.
Yeah.
Also, voice could also be put in that as well. Then we have language disorders. So this is anyone who might have trouble understanding others, sharing thoughts and ideas and feelings. So that receptive and expressive language. That's also with kids or adults.
Yeah.
We've got adults after strokes, TBIs, things like that. And then kiddos who are developing and just need help in that area as well.
Yeah.
Within the language, we all learn this in undergrad and grad school. It gets preached to us all the time. It's form, content, and use. That's kind of our big three things we talk about with language. So form is how your language is being formed together. So it's broken in three components of like phonology, so the sounds, each individual sounds.
Okay.
Morphology, which are your components of the words that make things change meaning. So you have walk, and then you've had ing, walking. So a morpheme would be that ing. You added that on to the word. So it's like helps with your making sentence structures and stuff like that. And then your syntax, which are like your grammar rules.
Okay.
So that's your form, how you're piecing it all together. Some people have difficult time in that area of language, and we may work on that, especially with like older kids who have been delayed in language in the past. Well, then they're going to also probably be delayed in forming their correct grammar structures and things like that. So that's something we'll work on. The other thing is content, which is semantics, which is the meaning of words.
Right.
Which is crazy in the English language. It's pretty difficult. Multiple meaning words everywhere.
English is a stupid language.
Yes.
Like, it's so cool. English is very interesting, but like, my gracious, it's hard. Oh.
So this is where we work on the meaning of words. That's very much of a receptive and expressive language part. And then the last part is use, which is the pragmatics of language. Okay, so are you using the correct words properly, using the right inflection, things like that. But that's still a component of a language disorder.
Yeah. In
that sense of the way you're using your words. And are you using the correct ones? Does that make sense?
Yeah. So it kind of like sounds, I mean, it's like the building blocks of, I mean, literally, that's exactly what you're saying. It's the building blocks of language. So you're talking about like just the sounds, and then those sounds grow into words.
Right.
And those words grow into sentences, and those sentences grow into like conversations.
Right. And they have different words have meanings.
Yeah.
The way you use those words change your meanings.
Yeah.
I mean, there's all kinds of activities where you can say a sentence two different ways and it means something completely different.
Yeah.
So that's kind of what that means. So to cover, we've had speech disorders, language disorders. Those are two big areas we walk in. The other is social communication disorders. So that's just also working on social purposes. So any communication for a social purpose, whether it's greeting, making comments, asking questions, talking in a different way to suit the setting you're in. I mean, we all talk to different people different ways. Like, I'm going to have a different conversation with you than I'm going to have in front of my doctor. Like, I'm not going to use the same. And I'm also going to talk to my toddler very differently than I do my doctor or my boss. So, like, That's kind of how that goes. Following rules during a conversation, being able to tell a story, stuff like that. Those are kind of those components of social communication that we work on.
So would that be things like recognizing like social cues in a situation where it's like, oh, your story's going on too long.
Yeah.
Like, you need to cut it off.
Yeah. Well, how to give them the tools to notice when things are seeming a little inappropriate.
Yeah. I did not mean to imply that like you would tell somebody, be like, okay, push. Like,
no, yeah.
Your story's too long.
And I'm only like touchy about it because I mean we have such a weird. We have had goals like that written where it's like so and so will take 4 turns in a conversation. In the speech world, and we're in a movement right now to move away from things like that.
Yeah,
because that's not very natural. Like me and you are not sitting here counting how many turns we've had in this conversation. That's weird.
That is weird.
And so we don't teach kiddos to do that, but we do teach them to like look for social cues. Like I can look at you to see like, okay, is he gonna speak now? Is it his turn? Have I really took too much of this time?
Yeah,
things like that. You know what I mean? And how to be appropriate with it to make other listeners comfortable, because we also want that individual to be comfortable in their communicative environment, and if others are comfortable, they're going to be more comfortable as well. Does that make sense?
Yeah. It's interesting. Yeah. I've never
see his shows like pragmatically he did not agree.
No,
but
that's
not
true. That's my of like I'm processing what's happening because I've never thought about that before.
Yeah, that inflection was not.
Sorry. Oh God.
Well, we're going to analyze his behaviors right now.
No, it's interesting because I've never thought about that kind of those components of it, and so I'm just kind of like I'm working through it in my own little brain.
Yeah, I will say at the speech world we don't explain all this stuff out to everyone. I feel like we just kind of do it.
Yeah.
So.
I think it's interesting.
We got to explain it out more.
And I guess what I was thinking like is how it's interesting that this idea of like modulating your communication to suit the situation increases the comfort, because you said like it makes the listener more comfortable, which is interesting, which I found that part particularly interesting because like a lot of the movements these days, like the neurodivergent movement and stuff like that, is kind of more about the world becoming more comfortable with people that are a little different, or like different than like your preconceived expectation.
Right.
And so that part was interesting. So I was like working through that because I was like, I wonder if that aligns with whatever. But then you kind of explained a little bit more where you were like, it makes the listener more comfortable and therefore you more confident.
Right.
So like you can be more confident in your own communication because you are confident that other people are understanding the meaning that you are that you are trying to express.
Right, absolutely. So like for an example in this, if you have a person who stutters, I'm definitely not saying that people around them should just expect them to be fluent at all times in order for the listener to be comfortable.
Right.
But if someone who stutters wants to give a speech or a presentation at their company to unfamiliar people and they want to feel confident about it, well then that's something like them getting those skills to produce fluent speech during that presentation is going to make the listeners more comfortable, which is going to make him feel more confident, him or her more confident during that presentation.
Yeah.
Does that make sense?
Yeah.
It's definitely not about the listeners.
Right.
But it's about building up that confidence for them in that particular instance.
For sure.
Because there are plenty of people who meet stuttering. They're going to stutter. Yeah. But we give them the tools to where they can use fluency shaping techniques when they need it, but not all the time.
Yeah.
If that makes sense.
Yeah.
Same way like we use dialects. Like I use a very like Southern dialect occasionally, but I can kind of turn that on and off to fit what situation I'm in.
Sure.
You know, if I'm speaking in front of a crowd, I don't want to give them a bunch of y'alls all the time.
I say go for it. let the southern twang fly.
Yeah, because I mean, I don't know. But that's kind of what I mean by that.
No, that makes sense.
Okay.
I get it.
So anyway, there are social cues and rules that people follow in order to help themselves feel more comfortable too. Sure. So they can be a participant in the environments they're in. I mean, also places like that, they're like schools, libraries, there's social rules in those places that you don't want to break accidentally. Yeah. And become someone who's like sticking out. Yeah. To the point of like not being able to participate because there are a lot of rules.
Yeah. I get that.
I don't know if that makes sense.
No,
okay.
That makes sense. Because, I mean, like, I can imagine, like, being a person who feels a little insecure about their ability to communicate,
Mm-hmm.
and that becoming the insecurity, even if they have the skills,
right?
Like, just the insecurity that, like, oh, maybe I'll mess it up,
right?
That preventing them from like engaging in that way.
Yeah.
You know.
Yeah. I will say
the mental health aspect of it.
We are changing, the way we do think about social communication, because it's, once again, it's not we don't want to force people to fit into one mold.
Right.
But we do want to be able to give them the skills to succeed in whatever environment they want to be in.
Right. You're just adding tools to the toolbox.
Right. Not saying, hey, you have to do this.
Yeah.
So that's an important component of that. So we've had speech disorders, language disorders, social communication is what we work on. We also work on cognitive communication. That has a lot to do with executive functioning, skills, problem organizing thoughts, paying attention, remembering, planning, problem solving, things like that. A lot of times these are patients who have had a stroke, TBI, dementia, anything like that. But there can also be, kiddos who have had seizure disorders, things like that. Mm-hmm. So we've seen that too, working with pediatrics, kiddos who have executive functioning difficulties as well. So
a lot of the kids that we work with, like, they just haven't developed those skills.
Right.
Right. Because of their whatever they got going on. Mm-hmm. They just don't have those executive functions. And
so those are something we can work on as well. I've definitely seen, sometimes we have to help with, like, what kind of verbal cues help, or what helps initiate, like, a task, things like that. That's very speech area to work on, things like that.
So tell me, so break this down for me, if you care to deep dive for just a second.
It's fun.
So talk to me about, like, executive functioning as it relates to, because executive functioning is also very much, OT is very much interested in the world of executive functioning, as it relates to, like, people's ability to complete daily activities.
Right.
Because you need to be able to, like, understand the materials that you need for a task, how to complete the steps of the task, carry out those steps, and then, like, wrap up an activity, like those planning and execution skills. So it's very much something that fits within the world of OT. Explain to me how that, like, fits into the world of speech.
Right. So, I mean, like we were talking about earlier, we broke down language disorders to all those, like, multiple parts. That takes a lot of organizing and planning if you have a delay in that area. So I think, like, that's kind of a good example. Okay. So say you have a stroke in, your language areas of the brain, and you're also not doing great with executive functioning. Like, we've got to tap into some skills, teach executive functioning, because they're gonna have to be able to organize their thoughts in order to create sentences, to put words together, because it's not gonna be something they're gonna be good at. They can't just, like, do it naturally. Like, currently right now I am not thinking about piecing my words together. When I said the word piecing, I didn't think, okay, I want to make this a present progressive verb, so I'm gonna say piece and "ing" and put it together. Like, I'm not having to, like, organize those thoughts. But if there are deficits, you're going to have to tap into those executive functioning skills to help with that. Sure. So there's also normally, impairments on executive functioning skills that we're going to have to utilize for that.
I see.
Other concepts, though, like with dementia patients, they're losing their language.
Right.
And so they're also losing their executive functioning skills. So we need to be able to help them maximize their executive functioning skills to use what language they do have.
I see.
How can they communicate the best with the executive functioning skills they have? Does that make sense?
Yeah.
I mean, because memory helps with word retrieval.
Yeah.
All of these things, they're all connected with each other. Can't really do speech without executive functioning skills.
Yeah, no, that makes sense.
Altogether. I'm trying to think of more specifics, but
I think that makes sense. It's the notion of, like, you have to have all of these planning and sequencing skills in order to, like, string together, like you said, like, organize your thoughts and then string together communication that's understandable.
Right. I mean, it even has that social component of, like, understanding, like, having the attention to participate in a conversation.
Yeah, for sure.
So I think executive functioning, one, it can make deficits in the other areas of communication. And then also those other areas in communication, if they're in deficit, then we can work on those executive functioning skills to overcompensate for some of those. Does that make sense?
Yeah.
So, like I said, if someone's having a deficit in language disorder, maybe we can use some of those executive functioning skills to help better communicate.
Yeah.
Trying to figure out how we can use that to maximize what they're doing. But at the same time, if their executive functioning skills are impaired in any way, that could impact their social skills or their language skills, their speech skills. Because you've got to organize your motor movements for
That's
speech.
true.
Like, there's all kinds of connection there.
Yeah.
So,
Interesting. Okay.
yeah.
No one's ever explained that to me.
No, that's okay.
Like, I knew that was, like, I know that's a
We don't really
part,
talk about,
but
like,
no one's ever,
cognitive stuff too much, at least right now in our pediatric world. I feel like we should talk about it more.
Yeah.
Use executive functioning more
Yeah.
with our kiddos. But also at the same time, it's not fully developed, as you've discussed.
Right.
So maybe that's why we don't maximize on it the way we would with adults. We want to help them with those skills, try to use that for them. But
Yeah. There's many occasions that, like, our friends in the pediatric space, because you're, like, in my experience, people talk about, like, cognition and, like, all of those kind of cognitive processing skills with adults. I'm talking about, like, I hear that a lot, but I don't hear people talking about it in kids as much.
Yeah.
From a speechy world, and maybe that's just because I'm just not hearing the right conversations. But there are many, many times I'm like, my kiddos are struggling in these areas because of executive function difficulties that are presenting as all these other things.
right.
But I'm like, I want, like, the speechy, I don't know. I guess, I don't know. Just a thought. I guess
No,
I don't
I
have
mean-
any, like, actual point, but, like,
No, I think we do forget to take in
a thought.
consideration that those executive functioning skills are impacting the speech skills.
yeah.
To the point of, like, like the task initiation, stuff like that. Like,
joint attention.
yeah, are we worried that, is it the executive functioning that's impairing the task initiation, or is it their receptive language skills? They just didn't understand what you said.
Right.
So I think whenever they're so little, we just kind of assume it's a language delay.
Yeah.
But I definitely would love to dig deeper into it. We may have to do a whole episode on executive functioning.
I think we should.
Because I would really love to do more research about it as well.
I think we totally should. I think that's very interesting.
Especially since we totally just took a whole turn.
Yeah, like,
whole
executive
turn there.
functioning is so interesting, and that's something I'd never heard of until, like, entering the world of therapy, and really didn't even hear of in school.
We talked about it in neuroanatomy classes all the time, but that was really it. Like, I don't remember it being talked about in my pediatric classes, really.
Yeah, but it's so important.
Yeah,
I have
it
many.
is.
Like, I'm thinking of examples of, like, instances in which this is definitely executive dysfunction,
Right.
but it's affecting kiddos' ability to communicate. Like, especially our kids who are, like, learning to use AAC devices and stuff. I'm like, they have to learn the sequences and the processes to even initiate that, like, use
Right.
of this thing. They have to have the joint attention to be able to, like, we have to be able to shift attention. I mean, there's a whole we could
Yeah.
go into a whole big long
We
thing.
really could. And that's why they
I'll
call it
pause.
cognitive communication disorders. Because,
Yeah.
like, it is a gray area of,
Yeah.
is it communication, is it cognitive, or are they the same thing
Right.
in this
Is one
area?
affecting the other?
Right.
How are they?
So it's just,
that is interesting.
if you drew a Venn diagram, it would be pretty crazy
Yeah.
of what all could be where.
We'll have to. Okay. Ideas for new episodes. We won't dive too much deep. Like, we'll move on.
Yes. Okay. So speech
but-
people, we do speech disorders, language disorders, social communication, cognitive communication, and last but not least, we have swallowing disorders. We'll talk a little bit about how that got added on to us,
Yeah, 'cause,
but
like, I'm very curious as to, like, how
I know
does swallowing become?
I'll add that on after we talk
Oh.
about the history of regular speech.
Okay.
But swallowing disorders, we work with dysphagia, which is a swallowing disorder. We work with feeding and swallowing difficulties, what might happen after illness, surgery, stroke, or injury, as well as our developmental kids. Wow, really struggled there.
Dysphagia spelled with a G,
Dysphagia,
right?
Yeah.
D-Y-S.
Some people say dysphagia.
But
Some
then-
people say dysphagia.
But then there's also, like, dysphagia that's like aphasia.
Yes, we also have aphasia. So
But don't people call it dysphagia sometimes?
yes. Well, yeah.
Aphasia and dysphagia is the same thing. Do you know what I'm talking about? D-Y-S-P-H-A-S-I-A.
Yeah. Yes. Don't confuse the podcast.
aphasia.
Don't confuse the podcast.
Well, it's confusing. for
I
me.
say dysphagia because I'm like, if I'm like telling somebody quickly, like, hey, my patient has dysphagia, I don't want them to think I said aphasia. Or
Sure. Also, what also it totally reminds me of dysphagia reminds me of Austin Powers when he's like, "I'm your phagia."
You're ridiculous. Dysphagia is like disordered swallowing, disorganized swallowing. Yeah.
Okay.
Aphasia is lack of language. Is that's after a stroke.
Yeah,
You
yeah.
might hear somebody has aphasia.
But don't people call that dysphagia?
They might call it
sometimes?
dysphagia if it's disordered language. You got to think about like
Oh.
the prefixes. No, because the aphasia means without language. Dysphagia would be disordered language.
Okay.
Kind of like apraxia is without organization. Dyspraxia would be disordered organization. It's all about the words.
Weird.
Yeah.
Okay, so confusing. Okay, sorry. So swallowing challenges, dysphagia.
Yeah, so we work with that. So those are our big areas that we've talked about that speech works with. And so, like, if you were to say, hey, what does a speech therapist do? They work with speech disorders, language disorders, social communication disorders, cognitive communication disorders, and swallowing disorders. Okay. But, fun facts, we also do a couple of other things. We can do oral rehab, which is AURAL, oral rehab, like hearing rehab.
Okay. Oral.
Oral. We work with AAC, which that goes with our communication skills. We also can work on increasing communicative effectiveness for any individual who might want it, and that can be with like accent modification.
Oh. Okay.
Or fluency enhancing,
Interesting.
because we do have patients who are a stutterer and they're proud stutterers, but they may want some fluency enhancing techniques for when they need them.
Sure.
So that's important to mention there. We can work on gender affirming voice care. We can work on vocal hygiene. So someone who might not, say need it in the sense of like it's disordered, but may want it to better participate in their environments. So even like with vocal hygiene, a coach or a cheerleader or a singer who uses their voice really loudly all the time, we can help with those skills.
Yeah.
Does that make sense?
So, yes, it does.
Okay.
My mom, at one point in time, had vocal cord dysfunction. I don't know if she still got it. I don't know how that works. I don't know if it goes away. I don't really know. I don't really know how that works.
I don't know your mom's case, so I don't want to like mention on it.
But, like, she went to a speech therapist. But she was totally able... I don't actually remember all the symptoms that she had going on. Oh, she's gonna listen to this and she's gonna be like, wow, Jonathan, wow. But she had, like, vocal cord dysfunction, and she saw a speech therapist, and that was wild to me because they just worked on breathing. Like, they worked on... Well, I say that, but truly, like, their main kind of treatment, intervention approach was, like, breathing strategies to help her vocal cord dysfunction, which was apparently like, and tell me if this is wrong, like her vocal cords were like spasming, and they totally weren't working together.
Right. Makes sense.
So like, how does that fall into stuff?
Just asking the hard questions.
I guess that's my question.
So I mean, that can go in speech disorders, because voice is going to impact her output of speech and the way it sounds. It can also just kind of go in that other category, because it is about how maybe she may have had some pain with her voice. I don't know if she did.
I don't remember what
That's
her
pretty
symptoms
common
were.
for people to say they have pain in their voice, or in their throat, but it's actually their vocal cords. So that could be possibly it. But we do have to work on, those breathing strategies. We do have to learn about the anatomy of all of your breathing structures, because that is a big component of speech. Speech literally is breathing.
Yeah.
So that is a huge component.
That's wild.
Yeah, so if you think about it,
Literally never heard it.
you take a breath in, everything you're putting out, your output of speech is just your breath out.
That's crazy.
So to break down what speech is literally your vocal folds are moving to make, and your articulators, so your lips, your tongue, your soft palate, your teeth, they are moving correctly to shape your air coming out of your mouth to make sound.
That is so interesting. I have never heard somebody explain that like that. Like, I have heard before that, like I've heard speechies say how like, yeah, we, you know, everything from like the diaphragm up,
Right.
you know, they're like, we got you. But I've never heard somebody actually like describe like speech as just breathing.
Yeah.
But that's totally makes sense.
So if you take a short little breath, you're only going to get so much out.
Yeah.
So that's why you may have issue getting a lot of output for a long period of time. You may sound like you're running out of breath when you're speaking. That's why things get harsh in your throat when you can't breathe well.
So then, like, would speech people... Now my brain just going.
No, it's okay.
Would speech people have a role in, like, people who have, like, diminished lung capacity?
Yes,
like, after
absolutely.
lung surgery or, like, lung cancer?
Yes,
or
absolutely.
COVID
Have you seen
or
those
something?
cool little... I totally can't think of the words right now. The devices where they hold it up to your trachea right here.
Mm-hmm.
And it speaks for them. The speech generating devices.
Is it the ones that, like, you... Like, they vibrate?
Yes.
The device is vibrating?
Yeah, and you hold it up to here, and it helps everything vibrate, and the sound comes out.
Mm-hmm.
I mean, that's doing the job of your upper vocal tract.
Interesting.
So,
That's so interesting.
because, I mean, you're not getting enough air out to create that vibration.
Yeah.
Because there's a lot of pressure there that has to come out and down.
Is there such a thing as pulmonary rehab?
Yeah.
Is that a thing?
Yes,
Do
absolutely.
speech people do that?
We don't do that. There are pulmonologists and people who do the rehab for that. We work closely with them in the hospital setting.
Okay. I'm like, no, there's like, there's a whole nother, like, there's a whole nother world of speech out there.
So, like, we have a joint friend who I've worked on breathing with him before.
Okay.
He has he had seizure symptoms. He had seizures, surgery, brain surgery, all kinds of stuff.
Yeah.
Complicated case, but he has dysarthria. Even though he like a kiddo, I've never had a kiddo with dysarthria, so that one was a big one for me. I know it happens, but his case sticks out to me, and we had to work on breathing a lot because he needed bigger breaths in order to have more organized speech coming out and louder speech coming out. Like, it has so many components to why we work on breathing.
Yeah. That's interesting.
Yeah.
I love that. By the way, that friend is doing great these days.
He's doing great.
He is. He's so funny. We like, he's talking a lot more these days.
Yeah.
And he's like laughing and giggling, and we cut up, and he cracks me up. I love that kid.
So yeah, there we go. Speech is a breath. That's really what we learned.
I mean, really, that's amazing.
Yeah.
I love that description. Oh my gosh.
What?
I just pictured I need a graphic designer to like make us a shirt that says speech is a breath, and it's just a person with like a puff of air coming out of their mouth.
It just can't look like a smoke thing. Because that's what I'm picturing right now, and I'm like, no.
No, we're not
No.
advocates for smoking.
No. But yeah, something like that.
That'd be so cool. It looked like wind.
Like, yeah,
Like an
wind.
airbender.
Like,
Oh
yeah,
my gosh.
that would be cute.
That'd be so
That would
cute.
be really cute.
Oh my gosh, speechies are the airbenders of that.
We really are. Speaking is just airbending.
Okay, so like if
The
speaking
vocal
is
folds are
airbending-
airbenders.
Oh my gracious.
Wow.
I love that.
We just nerded out. I really want a shirt that says my vocal folds are airbenders.
I love that.
I
We
want
need it.
one.
Listen, Avatar: The Last Airbender sponsor us.
I want one so bad now.
I love that. We need to make that happen. Okay. I'm so into that. Now I'm like, what would OT people be in the world of Avatar? What? We'd probably be waterbenders, probably.
Sure, I don't know.
We're
We're
resourceful.
waterbenders too.
No.
We have the swallowing mechanisms for waterbending.
Okay, whatever. Like, pick one. Pick one.
You're earthbenders over here.
No, PTs earthbenders.
Oh, true. God, are y'all firebenders?
No. Maybe. No, I don't think so. No? Nah.
We'll have to think about it more.
I don't know. Well, we'll revisit this conversation. one
Okay,
day.
wow, we've really went around everything, but
Yeah. Okay, so like we've talked about what is speech.
right,
I think we
totally covered that.
got a lot of really cool information. I learned several things.
If you're
so
asking
then-
yourself about populations, we work with every population. We'll just leave it open to that.
Yeah.
You've kind of heard me mention some.
We'll need to, like, one of these days, we'll deep dive into a little bit of, like, how our fields look different.
Right.
Depending on the people that we're working with. That'd be interesting. And maybe we can have some fun guests. Maybe we can, like, split it and, like, have some fun guests to, like, someone who works with in a more adult setting
Right.
versus someone who works in, whatever.
Yeah,
whatever it
because
looks
if
like.
you don't use it, you lose it, and
Yeah.
my brain is
It's-
so pediatric focused right
I
now.
know. Same.
So
I know. Listen, right now in school we're doing, not to take over the speech thing, but right now in school we're in like adult semesters where we're talking about typically adult clients, and it is different than what I'm used to. Okay, so then I guess from here, like, what is kind of a brief synopsis of like the history of speech? Is that where we go next?
yeah, let's do some history of speech. Are you ready?
I'm ready. I'm excited because I genuinely have no clue. Like, I have no idea.
Well,
like,
I learned some while I was like digging around,
Yeah.
and I still feel like there's a mixed bag of resources. I feel like it's just weird. Like, speech world became kind of like a self-proclaimed profession
okay.
in a very weird way.
Okay.
So there's kind of a bunch of branches who, kind of where speech got started, and it kind of came together into one organization eventually.
Okay.
If that makes sense.
Yeah.
So our first speech practitioners in America were not like certified clinicians, as there was nothing like an organizing body
Right.
to certify them.
Yeah.
But they were typically just like other professionals or educators, doctors, teachers, things like that, who just kind of self-proclaimed themselves as speech correctionists.
Okay.
Is kind of the term they used.
Mm-hmm.
So, in a short sense, people who would correct someone else's speech.
Like grammar Nazis.
Well, kind of. This is more of like, what's that movie? King and I? Is that it?
The King's Speech.
King's Speech, that's it. Yeah, I totally moved it to some musical thing. King's Speech, that's the one. Yeah. Where it's like fluency shaping type stuff, pretty much making you not stutter.
Okay.
So somebody who might be a doctor who's like, oh, I've got a lot of patients who are coming in who can't get their speech out clearly. I'm going to correct this. I'm a speech corrector.
Okay.
And they would kind of proclaim themselves as that. Same with patients who are deaf, who are trying to speak and trying to kind of incorporate them in, more of like the Society of America, being able to speak verbally.
Mm-hmm.
So kind of correcting their speech is kind of the other areas.
Correcting in air quotes.
Yes.
You can't see the air
Thank
quotes.
you.
But
Thank you for
Magnolia's
saying
doing
it.
the air
I'm
quotes.
doing air quotes.
Yeah.
I'm not a proponent of this correcting
Yeah.
in air quotes.
Yeah.
But this is kind of where they kind of started getting the first ideas of like, hey, if you prolong your speech, you reduce stuttering. Hey, if you sing a little bit, you reduce stuttering. If you change the way you're moving your vocal folds, you reduce stuttering. This is kind of where all that kind of got started.
Okay.
So like doctors have the skills to know how to do that, and they have understanding about anatomy. So
Yeah.
I can kind of get where they're starting this. There's also a field back then called elocutionist. I don't know if we still call people that.
Elocution?
Elocutionist?
I've heard of elocution.
Yeah, it's just the skill of clear and expressive speech. So, like, distinct pronunciation and articulation. So, kind of thinking about giving a speech, you want to be really articulate.
Uh-huh.
So, that's kind of what they call themselves.
I think of elocutionist, like, I think where I've heard elocution is when people are, what's it called? Like, not debutantes, but, like, when people go to, like, manners.
Yeah,
like,
yeah.
They go to learn, like, manners. What is that called? You know what I'm talking about. Where it's like, we're going to have
Finishing
a
schools.
fancy tea.
Yeah.
Like, we're going to go to a brunch, and, like, you have to learn how to use all of your things and speak and walk. And
That's kind of what this is,
Right.
too. But actually, Alexander Melville Bell and his son Alexander Graham Bell, don't know if you've ever heard of him,
Oh my gosh. Hello, inventor of the telephone.
were elocutionists. And they both developed new ways of understanding, analyzing, and transmitting speech in 1872. So,
Cool.
the elder Bell there, designed a method called visible speech that provided a visible code indicating the position of the throat, tongue, and lips in the production of various speech sounds. So that's kind of cool.
Interesting.
That gave us a lot of
Yeah.
information about like how speech works.
Like the
Because I mean,
actual
I'm
profession.
sure without a lot of technology and getting imaging of the structure of like your mouth, your larynx, and all of that, I'm sure it was like, how in the world is speech coming out?
Well, listen, if anybody who is listening If you have never seen like a radiograph of someone talking, they have, you Google it. It is wild. It's like a picture of a head, like, I mean, well, it's like videos. They have videos of people who are like in a machine or whatever. I don't know what kind of radiography it is, but like you can watch people as they're speaking or singing or whatever, and like their mouths, it is wild to see just how much is moving inside of your face.
I see. When I worked with a professor in Auburn when I was an undergrad, and we would put stuff on people's articulators, and then this technology just made data of how much things moved. I truly didn't understand how it worked because I was just a student, but it was amazing. I mean,
like an electrode or something on someone's tongue?
Yeah, we had like electrodes on their lips, their teeth, their tongue, everywhere, and their jaws, and then they were like sat under a machine and it tracked all of their movements.
That's so interesting.
Yeah. So, like, but can you imagine here in the...
They didn't have that.
No, they did not have that in the 1870s.
Wow.
Did not have that. And so it's really cool that they learned, about sound waves, stuff like that, to kind of get an understanding. So they gave us a lot of information for that. A lot of, like I said, early clinicians, though, they did work on that speech correctionist in the stuttering field, in the deaf community, things like that. There were also a lot of English teachers who kind of moved over into this field because, I mean, as I've mentioned, we came with a lot of that form, content, use type stuff. That's very English teaching type stuff.
Yeah.
So our first group actually was school teachers, and they started attending. We're actually kind of a part of the National Education Association, so that's something that's still around for teachers. The NEA.
Yeah.
That's still around, so we were a part of that for a little bit.
That's cool.
Yeah. And so we kind of built itself up more and more. Eventually, the American Academy of Speech Correction was made. It had 15 women and 10 men. Amazing that there are 10 men in it.
Wow, that's interesting.
That's how it started.
I have met 2 men in speech my entire life.
Right. And this is kind of where schooling got started. And then a leading graduate program started in 1914 in the University of Wisconsin. So people started getting like full degrees in the speech correctionist. I keep doing air quotes every time I say speech correctionist. I just don't want to be called that. So, so that's kind of where it got started. Way back when. They did eventually create ASHA in 1926.
Oh wow!
I know, pretty early.
It's a long time ago.
So that is the governing board for us.
It's almost your 100-year anniversary. Almost 20th anniversry.
20th.
Almost your 100-year anniversary for ASHA.
We are.
It's a little bit behind AOT, whatever.
Well, we were there. We just didn't have like I think somebody needed to be like, hey, y'all are speech people. Because a bunch of people were just coming out like, oh, I can do this, Right. So there needed some organization. So it took a while.
It's fine. It's fine. 9 years after AOT, it's fine.
Yeah. But to answer the question of how we got swallowing, which is like a burning question for most people. In the early 1970s, a team began evaluating dysphagic patients in the neurology service. And the Dr. George Larson, was looking at it, and he was noticing that a lot of these oropharyngeal components of speech and vocal production, like why could the people who were a part of the speech correctors, why couldn't they help look at this? As in, they already have an understanding of the oropharyngeal components. So these people who are already working on that with speech and vocal production should be the ones to look at this, even if it's for swallowing. So that's kind of where it got started, just the idea of...
So you guys already understand what these things are. You understand how they move.
Yeah. So for like non-speechy people, our articulators and things like that are a lot of the same components we need for eating and swallowing. So it makes sense if we're already talking about how air comes in and out and we shape it to make speech. Well, then we might as well also understand how we take food in. And how we can swallow it down safely, because we've already learned about all of those. mechanisms. Like, that's already part of the anatomy we're learning about.
Right.
So that's kind of where that got in.
So it doesn't okay, so correct me if I'm wrong. So it doesn't necessarily have really anything to do with like the communication aspect so much. It was kind of a shift because it just made sense.
Right.
It's like I already know all of these things.
Mm-hmm.
Like I already know about all of these parts of anatomy and about how all of these structures work together and how they are in kind of sync with one another. It only makes sense that I also would be able to help you because all of those components are the same.
Right. And that's kind of the thing of like, we are not making any modifications to like any structures or anything like that. Mm-hmm. So like our scope is still just the physiology and anatomy of these specific things that have to do with feeding and swallowing and speech.
Yeah.
So you're still gonna, like, we still work very closely with ENTs, GI doctors, neurologists, things like that, because we cannot make any decisions outside of that tract. Mm-hmm. But I think it makes sense that we're the ones who are going to talk about your vocal fold closure during a swallow, because we're also the ones who are going to talk about your vocal fold closure during speech.
Yeah.
So we already have that understanding of anatomy, and we know how to use it in a rehab sense for speech and voice. So we also were able to encompass that into swallowing as well in a rehab sense.
Right. Now that makes sense. That totally makes sense. Because like, why would you have a whole nother group of people doing the same thing? Like, it would just be redundant.
And like those other doctors are the ones who are making the structural changes. Mm-hmm. But we are, like I said, we are only
like doing surgeries and stuff.
Right. Like, if you hear people having their esophagus stretched or getting Botox for their vocal folds, things like that. Those are things we do not do.
Yeah.
We're not going in to do these things. But we can do rehab on those structures because we know how to teach people how to manipulate those structures.
Right.
Because we have an understanding of that.
That's interesting. Okay, see, that makes total sense to me.
Right. And breathing is a huge part of swallowing, too. Whole nother thing.
Yeah, it turns out you can't do both at the same time.
Right?
I have tried, and it has not worked out well.
Yeah.
I mean, like, I didn't try on purpose. Like...
Right.
You know, it's called choking.
It's called choking. And we're here to try to help prevent that.
Yeah.
But I'm also really glad they're not like, hey guys, y'all just like fix all the swallowing stuff, because then that means we'd have to be like surgeries and stuff, and that just doesn't make sense.
Yeah.
We need a separate thing for that.
It's a different thing.
Yeah.
That's interesting.
Mm-hmm.
Yeah.
So that's why it makes sense.
I like it. See, that makes a lot of sense to me now. I feel like now I have an understanding. I kind of figured that was probably what happened. It was like, well, we're already doing it, so like, give it to us, like.
I mean, I'm sure that was like a very brief synopsis of like how it first kind of the idea got brought up. I'm sure there's been lots of fights ever since of like who gets to keep it. Mm-hmm. But I think what it boils down is speech people or speechies, whatever you want to call us, speech language pathologist. We have that rehab side of it that we keep.
Yeah.
We're not the ones, like I said, who are making those structural differences. I think that's the big difference.
Right.
Whereas, like, you have an ENT who's also going to look at those things.
Yeah.
Like, if you have vocal fold dysfunction, you should have an ENT look at your vocal folds.
Right.
We're not taking that over. But also, your ENT's not going to have time to do the rehab part for it. Because they've got all the other million things they're doing.
Yeah.
If that makes sense.
Mm-hmm.
Okay.
Well, yes. Because, like, rehab is also very different than, like, what doctors do.
Right.
Like, actual therapy is a very different thing than what most doctors are doing.
Right.
Because it's a different perspective. Mm-hmm. You know? Like, I mean, there's tons of people. I know many, many people who, like, will say that, like, even, like, orthopedic doctors and stuff, they're amazing doctors, like, great at what they do. Can do replacements and all of these amazing surgery and whatever, but like they don't understand the rehab of it as thoroughly or as well as like the therapy people. But it's just a difference of exposure and a difference of like perspective and a difference of focus. You know, it's
right?
Like you're making sure all these bones and ligaments and muscles fit back together, and we're making sure they work.
Right.
Does that make sense?
Yeah, that's a good correlation. It's a good way of explaining that.
Yeah, and it's like we have to have each other.
Like, we definitely have to have each other.
You can't have one without the other.
Right.
Like, we're all just part of a big team.
Yeah.
Which is interesting.
So speechies do a lot
Speechies do a lot.
And there's a lot of different versions of speechies. We're all very different.
Yeah.
Because we can all have, like, our own little passions within this huge field.
Yeah.
And so, yeah.
I love it. So what are the, what are common misconceptions that you hear about speech? You talked about, like, R.
I'll say other than, you just work on R?
Mm-hmm.
I don't know. My favorites, though, is literally just I had speech in school one time, and that didn't work. So, and I'm like, well, that's not all we did.
Yeah.
So, if you knew one speech person, I wouldn't judge all speech people based off of one speech person you may have had in school, just to clarify. Because, like I said, there's so many species out there, and it's all so different. And speech has changed a lot in the last 5 years.
Yeah.
Give that 10 years, we've learned a lot more through research.
So can you talk a little bit about, because you did talk about, like, how in the inception of speech, it was a lot of people who were really focusing on, like, correction.
Mm-hmm.
So what are some of the things that you see now that are different about, so, like, that's kind of where speech was.
Right.
So, like, can you talk a little bit about, like, where speech is now?
Right. I think right now, which we're very much huge proponents of the neurodiversity affirming movement.
Mm-hmm.
I think we're trying to better shape the speech field to fit that better.
Mm-hmm.
Because we're in a good place to be really good advocates for that.
Yeah.
And to help our speech friends, people who need speech, with that.
Mm-hmm.
So this is more of, like I said, the focus is being more on empowering people to feel like they can communicate and giving them the tools that they need to communicate effectively versus forcing them to communicate to, like, a certain standard.
Right.
I would say, and only accepting one form of communication.
Mm-hmm.
So that's where we're at. As I mentioned earlier, there used to be, we would say, better speech, but there is no form of better speech now. There is more clear speech people can have. There's more fluent speech people can have. There's verbal speech people can have. There's nonverbal speech people can use. It's just about what is best for each individual person.
Right.
And how can we help them in those areas.
It's making people functional
Yes.
with whatever skill they got.
Yeah.
Yeah.
So I think that's the biggest thing. We're just here to help people communicate how they want to. And we have the skills and we have the knowledge to understand how to help people, but we shouldn't necessarily prescribe that on everyone
Right.
we meet. Just because I hear an R that doesn't sound 100% correct with air quotes, that doesn't mean I need to correct it right away. Unless if that's truly impacting their life.
Yeah.
And truly impacting themselves. Does that make sense?
Yeah.
Same with stuttering. Same with autistic individuals. They may not always need speech services. That's not always the case. But there are autistic individuals who are like, hey, I really need help with these social communication skills that I'm having to struggle with. So, like, what skills can I learn to help me better participate in the social environment?
Right.
Whether it's just for a job interview or if it's to better participate in class, anything like that.
Yeah.
So,
that's
I think
cool.
that's how it's changed.
Yeah.
For the most part.
I love that. Definitely seems like it's more aligned with kind of the modern idea of helping people be successful in their lives.
Right.
With all of the strengths-based kind of the push, the big shift.
Yeah, and I think it's taking us it's humbling us as professionals though to not be like, I know it all, so here, let me tell you what needs to happen.
Yeah.
We have to remember that we're working with, humans. We need to use that humanity side of us to listen to them and what they want. And that has a big proponent too about, like, dysphagia and feeding as well. I think that's an important thing that speech therapists need to remember, like, when we're prescribing, their NPO status or their feeding status.
Which NPO means you can't have anything by mouth.
Right. If we're prescribing that, we really need to take into consideration all the considerations when it comes to, like, end-of-life care, things like that. We don't need to be like, well, I know this, so I'm going to prescribe this to you because this is what is best for you.
Yeah.
I think we always need to remember that we came from a helping profession and we are a helping profession, so it's important that we ask our patients what they want.
Yeah.
But then give them our knowledge and then collaborate to see what the best plan is.
I love that.
Whether it's feeding or communication.
Yeah.
So, yeah.
I think that's great. And I hope that a lot of, I hope that's the push in general, like for people on the whole in the world of medicine or in the world of therapy or in the world of healthcare or whatever it is.
Honestly, the whole entire world. Honestly, like
truly.
I have knowledge. Everyone has their own knowledge in any particular subject. If we can just share that knowledge in a helpful way, but also be willing to like collaborate with others, I think that would make the world a better place.
Right. I think it's fun. I'm glad that that's kind of the shift that speech is making, because, I mean, not to like brag on the world of OT, but like that's very much, and it's very much a concept that like OT people resonate with,
right?
But like hardcore, because our whole mission is to like make you functional, independent in whatever way makes sense for you. Like, there's a concept in the world of OT that like the client is the expert of their life. Like, I can't tell a client what they need, what they don't need. Oh no, my light for my plants just fell. I'll figure that out. I'll fix that in a minute. That's wild. But it's very much a concept that exists in the world of OT, that like the client is that they are the expert.
Right.
They are the expert of their own. I'm the expert from an OT standpoint, so I know what I can offer as assistance and can offer as support. But like, you're the one who has to tell me what's going on in your life,
right,
where you need support. You know, and so that makes my OT heart feel very happy to hear this kind of shift.
Right.
I love that.
I love that too. Because, like, one of the things I thought about a lot when we talked about OT and OT month is, like, the word, like, adaptive. Like, we use that a lot when talking about OT. But I feel like the only time we even talk about that when it comes to speech is talking about AAC.
Yeah.
We don't really try to adapt anything else.
Yeah.
We're, like, a lot of times with the older method, it's like, here is the correct way.
Right.
The one correct way, with no willingness to adapt.
Yeah.
And so I would really love to see a push of us really like pushing those boundaries and how can we adapt other speech areas to better fit our patients.
I think that's great. I love that. I really love that. Do you guys have, last question before we wrap it up, do you guys have, like in the world of OT, we have kind of there's a couple like major approaches that you hear about a lot. You have like, I'm not going to go into the specifics,
That's
but
okay.
There's a couple of approaches where like one of them is, you know, like there is some sort of like physiologic dysfunction where like maybe you have low muscle tone, like you have some weakness, or maybe you have some like range of motion difficulties, or maybe you have some cognitive impairments, and you're trying to rehab those skills. You're trying to build up your strength, or you're trying to build up your range of motion, or you're trying to build up your cognitive processing capacity. But then there's another approach that is the adaptation approach. It's called a rehabilitation approach.
Right.
But it's the notion of like you are adapting the situation, or you're providing tools, or maybe you're changing the way that you're doing the activity to suit the person with the skills that they have. Does that make sense?
It does.
Where you're not trying to fix them in air quotes. You're not trying to fix a problem.
We really need an image for our air quotes.
We really do. We need like a little like...
Or maybe we just use air quotes too much.
Right, we do. We totally do. But you're not trying to like, quote unquote, fix a problem.
Right.
You are trying to make them successful and as functional as they can be with whatever skills they got, you know?
So the biggest thing I think of there, we call those mostly compensatory strategies in speech world.
Yeah.
That's the way I learned it in school. There may be other words that people learned it. Specifically, I'm thinking about like kiddos with like cleft palates and things like that. Even after the corrections, if, you know, the speech sounds, you know, they may not always come out 100% like accurate with air quotes again. But we can teach those like compensatory strategies of how they can make sounds to get the closest to the word they want to say so they can be understood. Same with like aphasia patients, so the ones who have trouble with language after strokes, we give them compensatory strategies like I can never say this word, circulomotion or circulomotion, I don't know, where you speak around a topic. So say you're having trouble with word finding like I just did. And I'm going to talk about other things around that word, and hopefully you'll get the word I'm talking about. So that's a compensatory strategy we may teach. versus just forcing them to sit there and think of the word
Right.
that they can't think of. That would be kind of what I'm thinking.
I need to do that more often because I get stuck on words sometimes, and I'm like,
Right.
it's gonna bug me.
There's a bunch of different, like, when I'm thinking of compensatory strategies that we use for that. There's a bunch of specific names for those strategies. Where we talk about, like, giving, phoneme cues or semantic cues, talking about other things like that within those skills. But that's really all I think about it. We don't really call it adaptive unless if it comes to AAC and adaptive technology. That's the only time I've heard that term being used. But I would really love for us to look at ways that we can make things a little bit more adaptive versus only in the AAC bubble.
Well, I wonder if that's an area that, like, it sounds like maybe that's an area that needs more exploration because, it's in the world of OT, it's like it's literally a model.
Right.
And it's an approach to care that, like, we need to be considering based on what the client's got going on. And so, like, to give them the best outcome. Like,
and that's really our star of AAC, I think. And, like, we've kind of used it as the really big, broad term of, okay, this is what communication abilities my person has. What can I give them to help them maximize that?
Yeah.
Whether they do better with written language or verbal language or gestural, anything like that. That's kind of where we make those decisions, but that's really the only big area I can think of.
That's interesting. So cool.
But it's still a great area. I'm not limiting that area because it's huge.
Oh, yeah.
And
for sure.
It's growing rapidly, and I love it. But it's going to keep growing as we get more technology and are able to understand how we can better support our patients. So
I think that's cool.
Yeah.
We'll have to do a whole episode on AAC.
Yeah.
And all of the things. We have so many episodes to do.
I know. I hope people learn something about speech.
Yeah, I definitely learned a lot about speech. I learned, what did I learn? I learned about the, like, how speech kind of absorbed swallowing.
Yeah.
That makes total sense. Like, I love that. I learned, speech is breathing.
Speech is breathing.
Speech is breathing. There were other things. I will remember them when I listen to this back.
Oh, I love it.
But there's just a lot. Like, there's a lot of information all kind of coming out at once.
Yeah.
But I think that's super cool. Speech is cool.
We do a lot of stuff.
Cool. I think speech is neat.
And I think we can keep doing more.
Yeah. There's always room for,
there's
growth.
So much room for growth.
And so much more, like, exploration of all these different things.
Yeah.
So cool.
Anytime you have to explain speech out there, please don't just tell people we work on the R and make kids talk. That was the other misconception I have. Oh, they make kids talk.
Yeah.
Like, I don't make anyone talk.
Yeah.
I'm not a magician, just to clarify.
Yeah.
I feel like it's way different than that.
Yeah.
Like, the thought that I can just make a 2-year-old talk, like, that's crazy. You can't make a 2-year-old do literally anything.
Ain't that the truth?
So
2-year-olds are a force.
I use skills and strategies and create a relationship with the child. And
encourage.
And teach them
communication.
A bunch of different tools.
Yeah.
So anyway, and I give the parents the tools they need.
Yeah.
So yeah.
I love that.
Little synopsis at the end of another miscommunication.
Love. See, we should, one day I'll have to, like, write down. We'll need to, like, write down things and be like, things that we've heard about our professions and, like, go through the list of all the misconceptions that we've heard or, like, statements that we've heard that we're like, maybe not that.
maybe not.
So do you have do you have any closing thoughts?
No, I've given so many thoughts.
Okay. So do you have a therapy win of the week? I have given literally zero thought to a therapy win of the week. Give me a second.
I did have
Oh my gosh, I have one.
Dude.
Sorry, go ahead.
Where's your social awareness cues to let me have my moment? He hasn't talked enough on this episode, so it's going to be
I talked a lot.
A struggle. But one of my therapy wins, not a win for me at first because there was a lot of sensory play going on, and I was like, this is messy. Like, I was co-treating with an OTA who used multiple colors of paints and let the child mix them.
Fun.
Like, it hurt my soul to watch.
Yeah.
But I stayed calm. I was really proud of myself while the kid mixed. I showed no reaction. So anyway,
Okay.
The issue in this case though is we were using AAC.
Oh no.
Also during the session.
Yeah.
But we had been practicing it a lot before the paint came out. Like we had already got like high repetitions in with playing a game where we took them out.
Yeah.
And so I was doing a lot of the modeling before, but while she had paint on her hands, it's like she had the awareness that she just did not need to touch the iPad, which is really cool, first of all, that she didn't just like grab the iPad. But she would kind of gesture towards me and kind of move me to like, hey, you touch the iPad.
Yeah.
hey, tell this OTA I want more paint, please.
Yeah.
So it was just really funny to me.
I love that.
First of all, she had the awareness of like, hey, don't touch the iPad. You're
Yeah.
covered in paint. And also she used like her skills of like getting my attention and getting me to press the button for her.
Yeah.
And I was like so proud of her.
I think that's awesome.
I know.
Aw, good
So
for
sweet.
her. I
But
love
boo
that.
the paint. I like washed my arms off for days. But anyway,
You know, listen, paint is fun. We love paint.
it was like 5 colors.
I will say paint is so fun, but it does stress me out sometimes because I'm like, I don't have a change of clothes for you. So I'm just like, sometimes I'm major stressed because I'm like, if you get this on your clothes. I don't know why. Sometimes we have like an acrylic paint that falls into the bag with all the other paints. And I'm like, whoever put that in there needs to be like, take a long, hard look in the mirror and be
Yeah.
like, what are you trying to prepare?
This was like
set yourself up for.
This was washable, but it was like extra shimmery. And she looked like a mermaid tail all over her arms. Like it was like
that glitter ain't getting out.
shimmer. And I was like, this is
That's
never
fun.
happening.
I love that. Good for her.
Good for her.
I love that.
Good for that OTA doing sensory play, but
Right.
whew.
I love it.
Anywho.
So my therapy win of the week, I had a little friend who has how do I want to preface this? He's a little friend that I've been working with for a long time. And we have a very strong. It's actually one I've talked about before on the
Okay.
podcast, and one of my therapy wins of the week probably. But same little friend. We've been working really hard with like some AAC stuff and our co-treats with speech and like doing a lot of. He's a little friend who is developing his play skills to be able to like engage and interact with other people during play, more social play. And he's becoming more like aware of social partners and like other people in his play schemes and things. And he recently, within like the last couple months, has started, well, probably like within the last month, has started waving goodbye to people, which is like major huge because he doesn't have a whole lot of like interaction, like communication in that direct communication. And literally last week he was waving and was going ba ba ba.
Aww.
And I almost cried. I was like, I can't even deal with what's happening.
That was such a good example for speech episode too.
Right?
Good job.
It was so sweet, and it was so sweet because he was waving to me as he was leaving. He was waving and going but, which he's never done. Like I've never seen him do that before. It was the first time ever, and I almost cried. And his mom was shocked. She was like, oh my gosh, he never does that with me, and it just made me laugh. And like it just makes it's those moments that like your heart gets so full.
Yes.
And you're just like, oh my gosh, this little precious little friend. He's just growing up.
What a good
He's
story.
He's becoming such a big kid. I just love it.
Well,
Okay.
happy delayed speech month, everybody.
Happy delayed. What is it? What's the new thing?
A speech language hearing month.
Happy Speech Language Hearing Month.
Yay.
Yay! Okay, we'll see you guys on the flip side.
See ya.
Bye.